Microneedling, that's what we're talking about today. I'm often asked, at-home treatments, are they becoming more user-friendly? Absolutely yes. Do I condone it? Absolutely yes. The more you can do at home, the less you have to go into a clinic, all the better. There's tons of things you could get done in a clinic if you really want to, but I'm always asked about different ones, such as massage tools, facial steamers, microcurrent therapy, of course, RF, radiofrequency, or high intensity focused ultrasound, HIFU, and things like Ulthera. And yes, they're getting safer and safer. But microneedling is probably the number one I'm asked about, probably the number one suited for home treatments. This powerful procedure has some really great benefits, but it does come with responsibilities, and I'm going to tell you about them today. We're going to go through some pre and post care regimens. Keep in mind just the device itself. It's important for it to be clean. The needles have to be sharp, and we don't want them coming off in the skin or the body. That's often a disaster I see. So there are risks: infection, post-inflammatory hyperpigmentation, scarring, and damaging of the skin, or people being too aggressive. This is the reason many people do opt to go to a professional to have it done. Not only will it be safer for most people overall, but an expert may use more potent professional level tools, making it worth the trip for many. Whether you're going it on your own or you're going to a clinic, this video will help you. Now, right off the bat, the number one thing I recommend to my patients who want to do it is Anteage roller system, because it comes with the kit, comes with the roller, and it has the growth factors. It's a 0.25 millimeter depth, and it helps with the absorption of the growth factors. For those that are using other systems, there are derma rollers. Okay, so that's the first one, and probably the first one that came on the scene would be the roller. The next one is a stamping device. And the third one is a motorized microneedling pen. And the pen uses usually a disposable tip, which is nice. It usually is like 12 to 18 pins on the head of the device. And the depths can be adjusted from 0.25 all the way up to 2.5 millimeters is common. The needle speed is up to 110 cycles per second. So it's a high RPM. So you get thousands of channels created, not only for absorption, but for collagen induction therapy from a pen like that. Some people believe the rollers create channels that are on an angle, if you will, as opposed to the stamps and the pens are straight up and down. And that's supposed to be better, thought by most, for collagen induction therapy. So absorption is one thing, but that collagen induction therapy is something totally separate. What are the benefits that you can expect from microneedling? Why is it that you're going to do this procedure? Minimizing pore size, fading acne scars, softening fine lines and wrinkles. It won't get deeper lines, but fine lines. Increasing the efficacy of topicals, and this is really important because we have topicals that work. Absorption is often the issue, getting them to the depths that they need to work, but this is a great way to do that. Rejuvenating the skin and overall glow. Keep in mind, many microneedling treatments now also include adjuncts. So like I said, radiofrequency, so you can inject energy with the needles. Some of them use a light source, so to stimulate collagen, like a red light. Some of them also use a blue light, and that's going to more kill bacteria and treat acne. So you can see how complex it is. When people ask me, hey, I didn't see the result from my microneedling, there's so many different types. So that gives you a rough overview. There are many for sure. So how do you prepare for your treatment? First of all, let's talk numbing, because after you get beyond 0.25 or 0.5 millimeters, it can get a bit painful, and people use numbing. And a quick story here, I had a patient in the other day, we put numbing on, and she actually had an allergic reaction to it, an immediate one. So these aren't benign products, and if you do get allergic to it, epinephrine, steroids, antihistamines is something we use in clinic, and that might be enough to send you to a clinic to get this done, because that's an emergent anaphylaxis when it does occur, it's not that common, but it certainly does, is an emergent situation, and you need to have a medical facility close. And some people carry an EpiPen, but this particular person had been exposed to numbing cream before, but still had that reaction. So historical evidence, or the fact that you've done well with it historically, doesn't mean you don't develop a problem with it. So be very, very careful. Less is more. I do very little numbing in my clinic because of incidents just like that. Also, with the numbing cream, be mindful, if it's not fully cleaned off, you can get a dermatitis, you can get redness and breakouts just from the numbing product itself, and never use an occlusion. But there are other things that you need to keep in mind. But just a word about numbing, because so many people ask about it. Now, what should you do to your skincare routine a few days prior? First of all, stop using anything intense. That'd be a way to describe it. Things like retinol, things like alpha hydroxy, beta hydroxy combinations that exfoliate. Even vitamin C's, when you get to 15 to 20% on the skin, they can be irritating. So most people would stop them about a week before, especially if you have sensitive skin. You want to use more things like moisturizers, gentle cleansers, hydrating serums, just basic things. Now, the day of the procedure, certainly I tell people, come with no makeup, no prior workout or sweating, and no direct sunlight, because that means you're coming in there to your clinic with inflammation. So keep those things in mind. Aftercare, very, very important. Avoid harsh ingredients. So lay off any chemical exfoliants. Think salicylic or glycolics, vitamin C's as well. Probably for 4 to 7 days. If you're using a retinol, it's fine just to wait 5 to 7 days. Now, there is an exception here. If you're using growth factor serums, I start them on them and I put them on immediately after the microneedling procedure. But if you're on anything but growth factors that are acids, that are retinoids, I think a good week after the procedure, especially, again, sensitive skin individuals. A lot of times you've broken that stratum corneum, or the outer layer, the protective barrier of the skin, by doing the procedure. So these are general guidelines, but the most important thing is, of course, listen to your skin and listen to your provider if you have one. I need to also talk about what you're infusing, and I think the elephant in the room here is, what are you using as a slip? And people need to be very, very careful. Obviously, platelet-rich fibrin, where we draw your own blood, is commonly what I use. A medical-grade sterile hyaluronic acid, but people get all kinds of wild ideas, and they put PLLA, polylactic acid, or things like Sculptra, or they just take their skincare off the shelf, or hyaluronic acid serum that you have at home, or peptides, and just start microneedling them in. Remember, it's going into your body, into your bloodstream, and anything with a particle size can cause what we call a granuloma. Typically, when things are over 60 microns in size, definitely over 100 microns in size, the body will then attack it because it's thought to be a foreign body. And then the sterility of what you're doing, and certainly blood-borne illnesses are an issue. So be very, very careful what you're infusing into the skin. It's one of the things that I tell people all the time. It just scares me how liberal people are with what's going into their body. Afterwards, 7 days, you can start your retinols and so on. Microneedling may also cause peeling of the skin. Usually doesn't last long, but remember, sunscreens are important afterwards because your skin is more sensitive. So other than simple moisturizers, consider a sunscreen, or better yet, stay out of the sun. Your skin's going to be more absorptive, and you can watch my videos on sunscreen that actually absorbs into the bloodstream. So for those of you worried about that, be mindful and take care of your skin. Sun avoidance is always preferable. Are you microneedling at home? What are your best tips? I'd love to hear what most of you are infusing into your skin, because that gives me great concern from a lot of people that reach out to me on Instagram, on YouTube, and certainly my patients coming into clinic. that are using products that scare me, that are going into the body. Be very careful about that. But I want to hear from you. I hope that helps. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.